The demand for a vaccine here in Connecticut may be at the highest point we have seen since the rollout began. Good evening, everybody. Thanks for joining us. But weeks into this latest tier, many of you are still having a very hard time scheduling that appointment.
And tonight, one town is guaranteeing no vaccine goes to waste by creating a waiting list. Channel 3 Eyewitness News reporter Matthew Campbell is live in East Hampton tonight. And Matthew, hundreds are already in line.
Yes, Aaron and Mark, more than 400 as of tonight, and after this report, there could be hundreds more.
We don't throw away any dose.
That was the goal of the Chatham Health District, and so far, it's an accomplishment that not many clinics or pharmacies may be able to claim.
We want to get every dose into people's arms. It's a scarce resource.
Director Russell Melmed says when a clinic is done, on average, there are some leftover doses.
Occasionally we'll have no-shows. Occasionally we'll get extra doses out of the vials that we're using.
The dedication to the goal of 0% waste hasn't been easy.
At the end of our clinics, we've been finding that we were making a lot of phone calls, trying to find people who needed a vaccine who were eligible. We kept handwritten lists of the people who would call our office.
So now the leftover list is virtual. You can sign up here on the district's website. Chatham Health District serves Marlborough, East Haddam, Hebron, Colchester, Portland, and East Hampton, but this waiting list does not discriminate by location.
We're a vaccine provider in Chatham Health District, but we will vaccinate anybody who's in the state of Connecticut who's either a resident or who's workforce eligible.
The only criteria is that you meet the current state requirement, which are teachers or those over 55. The list started at 40 people, but now that it's online, it's multiplied.
We were at around 460 people.
When clinics are over, the staff will go down the list looking for people who can make it to their location within 15 minutes. So far, that's been the recipe for success, and Melmed hopes other towns can do the same.
There are a lot of local health departments that are simply very overwhelmed. You know, they don't have the time to take a breath, or let alone to think strategically about how to put together lists. But there are probably also many local health departments that are doing this and just didn't make it public.
I love to. I mean, if there's an opportunity, I'd like to vaccinate it because my job pretty much required that I have to go to the work.
All right, now here's a little tip. Melmed says the best chance to get a call are on the days where there are clinics dedicated to educators. For whatever reason, he says those are the days that they usually see some leftovers, and the next clinic will be on Friday. That is the latest. Live here in East Hampton tonight, Matthew Campbell, Channel 3 News.